Dentistry often focuses on youth and aesthetics, but our seniors faces the most critical challenges. For many elderly patients, dental issues are more than functional. They are emotional, how they eat, speak and smile. Now let's discuss why patience is the real differentiator in senior care. Skill fixes teeth. Patience heals people. According to reports, over 65% of people over 60 have untreated dental issues because of fear, neglect, and inaccessibility. The needs of elderly patients differ drastically, from weaker bone structure to delayed healing. Common condition includes gum recession, tooth mobility, ill-fitting dentures, and medication-linked oral dryness. They are just not age-related. They are manageable. They are treatable with modern dentistry. Remember, age isn't the problem. Indifference is. Seniors often avoid dental treatment because of anxiety, fear of pain, and distrust of complex procedures. Many have faced outdated, painful treatment in the past. Building trust through calm communication, detailed explanation, and reassurance is the first step for the treatment. An 80-year-old patient postponed her root canal treatment for 2 years, not just because of cost, because of fear of pain. One calm consultation with her, and she said, "Doctor, you spoke more than you drilled." So that made me comfortable. Tools like CBCT, CEREC, conscious sedation have transformed senior care. CBCT ensures precision, reduce the guesswork, and stress-free surgery. CEREC allows same-day crown restoration, so no more multiple visits. Conscious sedation helps eliminate fear and discomfort, mostly in the longer procedure. Here I want to emphasize, technology is not to impress, is for comfort. For elderly patient, time and empathy matters more than speed. Listening carefully to their fears, family background, and their habits creates trust. Many seniors come alone. With some tinge of empathy, that consultation becomes both medical care and emotional care. A senior once said, "Doctor, you reminded me of my son because you listened." That's what modern dentistry needs to bring back, a human connection. I truly believe machines can't replace manners. A 85-year-old patient came with severe bone loss and passed multiple failed dentures. And we did not just jump on any kind of treatment. We sat with him for a few sessions just about the counseling, preparation, and digital planning, just to make him sure that yes, this time we will deliver the best. The result, successful full mouth rehabilitation done, and we restored the confidence to eat and speak. It wasn't just the implant changed his life. It was a time, reassurance, empathy, and care given to them. Dentistry for elderly is a family decision. Family plays a vital role in any kind of elderly treatments. Sons and daughters often need reassurance that their parents are in safe and understanding hands. Communication, transparency, and compassion turns the first time visitor to the lifelong families. At Loma Dental, we treat your parents like our own. Modern dentistry must evolve from being procedure driven to patient driven. Technology for sure change outcomes, but empathy defines experiences. I truly believe care shouldn't have an age limit. Dentistry may be my profession, but caregiving is my purpose. If you have been delaying treatment for your parents or for yourself, this is your sign. Modern dentistry can give back not just teeth, but freedom, confidence, and joy. Because every parent deserves care that feels like home. At Loma Dental, where senior smiles treated with patience, not pressure. As I always say, dentistry is not expensive, neglect is.